It's Mark Wallace with Grandbrook Memory Care, and this is the Senior Living video series with the Zionsville Chamber of Commerce. And with me today is Miranda with Paradigm Hospice.
Hello.
And I think today I thought we would tackle a topic that is something that's very important, I think, to understand. And there's a lot of misunderstanding with understanding the topics of hospice and palliative care. And I know those words sometimes get used interchangeably, but I think just for our viewers and those watching, it's important to understand too that what hospice is and what it's not, and understanding when is it time.
Yes.
I know a lot of families out there dealing with aging loved ones, aging parents, and this is a topic that may come up in the future.
Yes, I agree. Hospice is a very scary word to most of our population that we deal with. 30 years ago, hospice meant we come in, we take away all your medications, we give you big doses of morphine and Ativan, and you quickly pass away. That is not what hospice is today. Hospice is actually taught in med school and understood by physicians and medical staff more now than it ever has been. Hospice is a benefit that families have paid into their entire life through Social Security taxes. It focuses on quality of life versus quantity of life now. So we come in at the most precious time of anybody's life and make sure that the days or months that they have left is the most important days of their lives. With hospice, you get a skilled nurse. You're entitled to a hospice aide. With our company, a social worker, a music therapist, and a chaplain, and that becomes your interdisciplinary team. And we just focus on making sure today is the best day possible for you or your loved one, and then we repeat that the following day.
So it's not just about giving medications and having a nurse visit. It sounds like it's a lot more all-encompassing now. You said a music therapist?
Yes, music therapist. There's board-certified music therapists. They will ask what you or your loved one's favorite music is, and they will actually bring out their instruments and they will sing and play their music to you. And as far as medications goes, you don't have to stop any of your medications unless it's an aggressive treatment. So if we're bringing you on for cancer, you would have to stop chemo and radiation to have hospice. But you don't have to stop your blood pressure medicines and different things like that, and we don't automatically have to start morphine and Ativan.
Okay.
That's only if it's needed.
And I think one thing, a misconception I hear about a lot is when you use the H word, the hospice word,
Yes.
that it means that someone is going to pass away very quickly or very soon. And that's just not the case. Is that right?
That is not the case anymore. Now, you do have some families, late referrals, and they do pass away quickly, but your average length of stay for hospice anymore is your 6-month mark, or we've had patients on service for a year or two, and a frequent question that we get asked is how do you allow that to happen following Medicare guidelines? And you have recertification periods. So when you first admit to hospice, the first is 90 days, and then 90 days. And then after the second 90 days, that gets us to our 6-month period. Then it's every 60 days. And in order to continue your hospice benefit period, you have to show a small decline in order to keep your hospice benefit. We do have patients who graduate off of hospice. They don't necessarily get any better, but they don't get any worse. They just kind of plateau. So they graduate off of hospice. And then that's when we can refer to our palliative care team.
Okay, so talk a little bit about the differences now, because I know the words palliative and hospice they're thrown about a lot of times.
Yes.
I think there's a misunderstanding of the differences between the two and what they accomplish.
Yes, so palliative and hospice are two very different things. Palliative care is for the patients who are still seeking aggressive treatment, still wanting to go back and forth to the hospital, or just simply are not in the hospice mindset yet. So palliative care is billed under Medicare Part B, so it's just like going to the doctor's visit. It's a nurse practitioner who would come out to your home or your facility, whatever you call home, every 4 to 6 weeks or more frequently as needed. Paradigm is ACHC accredited, so our standard is we have to see our palliative patients once every 8 weeks to keep our accreditation. Palliative care helps manage your symptoms and your pain of your chronic or terminal illness. So for instance, a cancer patient. If you have a cancer patient who's still undergoing radiation and chemotherapy, palliative care is really good for that patient because we're able to help manage those symptoms and help their pain. So nausea, vomiting, any type of symptoms, and help keep you out of the ER.
Gotcha. So that there's definitely a difference there, but it sounds like one can lead into the other.
Yes.
Is that
so
how it typically works?
So palliative care, you never have to go to hospice if you don't want to. But if you're declining and you decide, I don't want, all of my physicians anymore, I don't want aggressive treatment, I don't want to continue to go back and forth to the hospital, then we can transition you from palliative to hospice. And we can typically do that the same day that you decide that.
Oh, okay. Well, this is great information to have because I think we're dealing with the aging population and so many families out there that I know you talk to and I come in contact with on a daily basis are really facing these end-of-life conversations, and we're faced with chronic disease management, whether it be cancer, Alzheimer's and dementia, cardiac issues. There's just that. I know a lot of families don't like to talk about it because that means we're really talking. We're making what seems like far out, kind of brings it right to the forefront of everyone's mind. But I think it's important to have open and honest conversations as a family about what wishes are and really the benefits.
Yes.
How can the hospice benefit? How can it help a family? Because hospice also is there to support families as well as the actual patient.
We are not just focused on the patient. So bringing hospice on board is family focused as well. After the loved one is to pass away, hospice stays involved for 13 months with that family, checking in on them, making sure they're grieving appropriately. If there's somebody that is having grief problems, having trouble coping with the death of the loved one, we would send our grief support team out there and help them, and then reach out to resources in the community to make sure they're best assisted.
Great. So it's a wonderful family benefit, not just, especially when you continue to provide services a year after the fact.
Yes.
I think that's a wonderful service, and I think it's something that is so needed. Hospice can also help out in other settings. It doesn't necessarily mean being in a hospital or in an inpatient hospice. You can do hospice at home.
We can do hospice at home, long-term care facility, memory care facility, assisted living, independent living. We can do hospice anywhere you call home.
Great.
Yeah. The biggest thing that I want to say about palliative and hospice, to just kind of help clarify the differences, palliative is for your patients who are still seeking aggressive treatment, and hospice is when you're ready for strictly just comfort.
Comfort and
quality.
But both focus on providing quality of life and easing discomfort during the process.
Yes, both provides comfort and quality. Yeah.
So when's the best time as a family to have conversations like this?
As soon as you get diagnosed with a chronic or terminal illness.
Okay. That's a hard conversation to have. What are some resources that families can turn to?
A lot of families will just reach out to a company and ask questions. You can reach out to any company. You can reach out to myself with Paradigm, and somebody can come out to your home and just have a conversation with you. You don't have to have a physician's order to have a conversation about needs and your potential future of your medical journey. That's what we as patient care navigators are here for, is to help you navigate through your unique situation.
Gotcha. Well, thank you so much, Miranda, for coming and joining us. I know it's so important. I think part of us being in having this video series is really to empower and educate families on their options so they don't have to really navigate this in the dark.
Yes.
So if folks watching us have questions, what's the best way to get a hold of you and learn more?
My cell phone number is easiest to get a hold of me. You can call or text me. It is 765-894-9025.
Great. Miranda, thank you so much again for being with us, and we will see you next month.
Thanks for having me.